Assalamu alaikum. In this part, I will talk about the origin and philosophy of Damon System. As we remember from previous part, we talked about the self-ligation system. We have two types of self-ligation system, active and passive self-ligation. So what is the difference between them? As we remember, if we need more torque expression, we need more complex tooth movement, we use active. Why active? Because there is no space between the wire and the bracket. There is no play. There is interlocking between the wire and the bracket without any space, without any play of the wire. So we can use it if we need more torque expression. But we must remember more friction. This is the active self-ligation system. So there is many systems related to active self-ligation system. And we talked about passive self-ligation. Passive self-ligation, meaning there is a space between the wire and the bracket. There is a play of the wire and low friction system as possible to produce efficient bone remodeling and to produce gentle force on the periodontal ligament. So this is the meaning of passive self-ligation, to reduce friction as possible in every phase of the treatment. So this is the small idea about the difference between the active and passive self-ligation. So the Damon system is the one of passive self-ligation system. There are many systems related to the passive self-ligation. So Damon system is one of passive self-ligation system. The Damon system is a passive self-ligation developed or introduced by Dr. Damon, Dr. Dwight Damon in 1994. Since then, both the bracket and philosophy behind the system have undergone continuous evolution. Dr. Damon tried to reach optimal force as possible, to increase efficiency of orthodontic treatment and reduce unwanted tooth movement or unwanted side effects of orthodontic treatment like root resorption. So Dr. Damon said, I would encourage the clinician not to look at this technology as a new bracket. It is a system, not a new bracket. A system developed to try to match each phase of the treatment with natural force as possible, each phase, even in last stages of the treatment. Natural force as possible, to not overload the muscles or to not overload the periodontal ligament, to reach efficient bone remodeling. So if we have efficient bone remodeling, as we remember from previous part, efficiency in orthodontic treatment, we can obtain it by efficient bone remodeling and reduce unwanted effect to the teeth and surrounding structure. So it is so apparent that if a clinician can apply appropriate force at the right time of treatment, the impact to produce a positive effect on efficient tooth movement. So Dr. Damon said, system, not technique, because system meaning that the clinician or the orthodontist can solve any problem that face him in the clinic. So this Dr. Damon called it system, not a technique. It is a bracket and wire, not only a new bracket. It is a system. So the principle and philosophy behind the system, Damon philosophy is the use of the concept of passive self-ligation. So passive self-ligation meaning a lower friction resistance. Reduction in friction helps to promote a force directly from the wire to the teeth and surrounding structure without any dissipation of the force by ligation system. As we remember, the ligation, previously the first ligation system is the gold ligature wire, and we remember that the gold ligature wire is expensive, and this replaced by steel ligature wire, and still gold and steel ligature wire have more friction, not gentle on periodontal ligament, and also time consuming. So it is replaced by elastomeric ligature ligation, meaning ligature elastic, and they saw that the ligature elastic, reduce the force with time. And we need active force, not reduce the time. So this, we need a system built-in locking mechanism. So from this point, the invention of self-ligation system, and we have two type, passive and active self-ligation. So the principle and philosophy behind the Damon system depend on three principles: friction, lip bumper effect, and posterior transverse adaptation. So what is the meaning of all these? What is the meaning of a friction? In Arabic, friction هي قوة الاحتكاك. دائما نعرف لما تكون أكو حركة بين سطحين لازم أكو قوة احتكاك. So the friction in English, we can define friction, the resistance to the movement of one surface to another. القوة المقاومة، الاحتكاك. So when an orthodontist tries to slide a tooth along the arch wire, the tooth is subjected to alternate movement of tipping, uprightening, thus moving in a sequential number of small and consecutive movement. دائما احنا لما نحرك الأسنان، دائما الحركة من يبدي احنا initial wire من الراوند واير للrectangular wire، دائما احنا نحركه دا يتعرض السن إلى مجموعة حركات من التيبينج، من الابرايتنينج، بالفاينل ستيجز حنوصل البادلي موفمنت. فهي sequential number of force. احنا دائما عندنا بكل محطة، كل phase of the treatment عندنا اكو friction. So the friction present in every phase of the treatment. The friction present during orthodontic sliding represent a clinical challenge to orthodontists. Why represent a clinical challenge? Because high level of friction, what is the meaning of high level? May reduce the meaning of high level, reduce the effectiveness of mechanics. So reduce the effectiveness of mechanics, meaning decrease tooth movement efficiency, meaning decrease the bone remodeling efficiency, and further complicate also the anchorage control. One of the primary focus of the search of an ideal condition of orthodontic tooth movement is reduction of a friction at the bracket wire interface أو ligation in certain stage of the treatment, therefore lower but still sufficient to promote orthodontic tooth movement. Lower friction but still produce movement. A low friction system is based on the free flow between the wire and the bracket slot. مثل ما نعرف احنا low friction يعني شنو؟ يعني اكو play بالواير، يعني اكو free flow of wire. To assure this free flow of the wire between the wire and the bracket, binding should be kept at minimum. So invention of self-ligation, built-in door, built-in locking mechanism. So in first stage of the treatment, we remember if we need low friction, we choose light force or light wire, small diameter of the wire with a broad slot. So this free of the wire permits lower friction as possible. The difference in the size between the wire and the lumen of the bracket leave an empty space. So this meaning minimize the binding. A small round shape wire will also minimize the binding at the entrance and exit of the bracket. So partial engagement minimize the tipping of the teeth. So we need to obtain a system with Biozone concept. لازم نعرف شلون نحصل على system يعطينا Biozone concept. As we remember in the previous part, I talked about efficient bone remodeling. The first tooth movement in the socket, and then there is bone remodeling. There is osteoclast in the tension area and osteoclast in compression area. And also there is a secondary bone remodeling. So if we have heavy force, the osteoclast, there is no frontal resorption, meaning not the resorption in the front of the tooth, or in front of the root. the resorption from undermining or underlining lamina dura. So we call it undermining resorption. And this, we can obtain it if we have a system with heavy force. Heavy force meaning the crushing of the blood vessels. So crushing of the blood vessels meaning the area, there is necrosis in this area, hyalinized area. So this will lead to reduce the efficiency, meaning increase the treatment time, reduce the efficiency of more remodeling. So we must obtain a biozone concept. So what is the meaning of biozone concept? We must know that the vascular tissue in periodontal ligament submitted to higher compression of force in some area. If the system expresses too much force of binding, the vascular tissue compressed. The vascular tissue in periodontal membrane have an internal vascular pressure 25 gram per square centimeter. Any action or any system compressing this tissue will crush them and reduce the blood flow. So the bioconcept zone or biozone concept, the vascular tissue must be in balance. The vascular tissue in collagen fiber in periodontal membrane must be in balance with intra and extravascular force, meaning the system must provide us with light force, not exceeding the pressure or the vascular force of periodontal ligament. The force that's related by vascular tissue in periodontal ligament must not exceed 25 gram per square centimeter. Because if the blood flow is blocked, this meaning inefficient bone remodeling, meaning decrease the efficiency of bone remodeling, meaning the lag phase, increase the time of the lag phase, 2 to 3 days. So undermining resorption occur, and this will not accelerate the treatment, will increase the treatment time. So with Damon system, there is a very little or no friction between the arch wire, especially in initial phase. In every phase of the treatment, there is no friction. This setup allows us to work with lowest possible force in all phases of the treatment, remaining with optimal force zone, with biozone concept, trying to keep the periodontal ligament from being compressed in such a way that leading to the ischemic zone. So partially compress the dental structure. So we obtain a system that provide us with efficient bone remodeling. So this is a beautiful system. Thanks, Dr. Damon, for this nice system that gentle to the periodontal ligament. So this we can obtain it by low friction. This is the meaning of low friction. Lip bumper effect. The other principle of Damon system is lip bumper effect. So what is the meaning of lip bumper? We know that the lip bumper is a functional appliance. Functional appliance, the function of this appliance is to reduce the force or to move the force of the muscles like lip and cheek away from the teeth to allow the arch development without overload by the lip muscle. So Damon system is a like lip bumper effect. Start with light forces. Light forces meaning copper nitride 13 or 14. This not overload the muscle as they worked as a lip bumper. So how? When we, in the conventional system, when we put wire and the bracket, we must remember or we must know that there is a resistance from the muscle to this insertion of fixed appliance. This overload from the muscle or resistance from the muscle prevents good expansion of the arch wire because of this resistance of the muscle. So we need a system that the muscles not know there is a difference between the natural force meaning the teeth. لازم احنا نوضح انه نقدر نوصل الى سيستم انه ما ينطينا، يعني احنا مثلا قوة الشفاء المصل قوة اللب والتشيك هنا المفروض إنه هي تشوف كأنه موجودة أسنان طبيعية، ما موجود أكو واير أو أكو براكيتات. أي واير أو براكيتات إحنا نحطهم لازم نحط بنظر الاعتبار إنه أكو مقاومة من السوفت تيشو اللي هي اللب والتشيك. في حالة إنه إحنا توصلنا إلى سيستم، يعني ما تقدر تفرق المصل، ما تقدر تفرق إنه هذا أكو شيء جديد، لا كأنه الأسنان موجودة طبيعية. كأنه الأسنان موجودة طبيعية معناها شنو؟ راح يصير arch expansion براحته، معناها ما راح يصير، فالضغط يقلل لي من هاي التوسعة مال فك. فلهذا احنا حنوصل لهذا السيستم من خلال الديمون سيستم. Damon System use a passive self-ligation, meaning low friction, and a broad arch wire, and also the profile of the brackets low, no high profile. And with this system, broad arch wire with low profile brackets provide us as a lip bumper appliance. The muscles, lip and cheek muscle, not know that there is a difference between the teeth and the system. So not overload the arch development. So we can obtain good arch development. Also, this system uses the arch wire, copper nitride wire, without uniform shape, only unique shape. There is no wire for upper and lower, no particular wire. So the wire resembles the arch development, arch form development. So you can obtain natural arch form without overloading the teeth. So this is the meaning of lip bumper effect. And also Aramco tried to produce many arch wire. If we read the smart arch wire, there is more wires with copper nitride wires with different level of force to obtain this effect, meaning the wire treated by laser and with 3 different force in the incisor area, in the premolar and molar area. So we can obtain differential force system. So this differential force system to reduce the resistance of soft tissue. This is the meaning of lip bumper effect. So there is a balance between the outside and inside, between the teeth and surrounding structure, without overloading or overload the muscle on the teeth development. And also for aesthetic, the setting of upper appliance parallel within lower lip, the interior teeth parallel with the lower lip. So this also we can obtain natural smile, natural veneer. Also, posterior transverse adaptation, this is another principle, third principle. As seen in this picture, there is a difference. We obtain a posterior adaptation or posterior expansion due to the passive self-ligation with low profile of the bracket. The arch wire, we can release light force, also facilitate the movement, facilitates the teeth movement posteriorly toward the buccal. So this posterior adaptation without resistance from the muscle, without resistance from the cheek. So it is called posterior adaptation rather than posterior expansion. There is no real expansion, but adaptation. The teeth moved due to the passive self-ligation and broad arch wire and the small profile of the bracket. This also, all these characteristics provide with natural force. The muscle not know that there is a difference between teeth and the appliance. So, as in this picture, we can obtain 4 millim or 4 to 5 millim expansion or adaptation. This provides space. This reduces the need for extraction, especially in teenager. So this is the meaning of posterior transverse adaptation. All these characteristics help us to produce a second chance. The meaning of second chance, due to all these characteristics, passive self-ligation, light wire, broad arch wire, without the resistance of the muscle, provide stable treatment as possible. Provide balance between the muscle and the teeth. As we see in this picture, the muscle that produce anchorage or stability, the orbicularis muscle, orbicularis oris, that surround the lip, produce sagittal anchorage. And the masseter muscle for vertical anchorage or vertical adaptation, and the orbicularis oris muscle for transverse adaptation. So we must know the muscle that's responsible for anchorage or for a stable treatment to reduce the side effect of this muscle as possible. So this system is a beautiful system, provide us as possible with good arch development. And when the wire developed slightly without overload from the muscle, so also this provides us with good breathing, also provide us with improve the natural tongue position in upward and forward. دائما لما نلاحظ انه احنا هذا السيستم موفر لنا انه البروفايل مال البراكيت نشوفها صغيره، الواير واسع، وايضا هو ثيرمالي اكتيفيتد. المصل ما تقدر تفرق انه اكو شيء محطوط بالاسنان اني اقاوم اتجاهه او ماكو، كانه اكو اسنان طبيعيه، فبالتالي راح يصير توسعه للفك براحته. هاي التوسعه براحته معناها احنا ايش نوفر؟ معناها اذا اكو مثلا ماوث بريفنج او اكو اي يعني ثام ساكينج او تانج ثراست، هذا الشيء الادابتيشن مال المصل راح يكون اسرع، البريثنج راح نقدر نحصله اكثر. يعني احنا لما يصير اكو ديفلوبمنت بالupper arch راح نحسن من البريثنج وراح نحسن من التانك position. So we can get second chance, improve the tank position and improve the breathing. Those who cannot change their mind cannot change anything. So change your mind. Try new system as possible to produce efficient treatment, accelerated treatment as possible. So recent advancement in Damon system. The Damon self-ligation appliance has certain characteristics that is easy in ligation, wire engagement without force relaxation of elastomeric modules that help us a constant active status of engaged wire. يعني احنا ما راح نخسر الفورس اللي حنحصلها، يعني بالليجتشر واير الجولد هو كان غالي، الستيل كان تايم كونسيومينج، الالاستيك راح نخسر الفورس مالتها بمرور الوقت. فاحنا نريد هم من لو فريكشن وهم من نريد بنفس الوقت تكون اكتف. لهذا اقترحوا السيلف لاجيشن. So Dr. Damon tried to develop this system over 30 years. So the development of this system, Dr. Damon tried to change the bracket design and also aesthetic and for increase the torque control and reduce the force dissipation as possible and reduce the friction as possible to produce efficient tooth movement. So in 1996, Damon self-ligation, and in Damon 2 in 2001, and in 2004 Damon 3. Damon 3 as seen in this picture is aesthetic bracket, clear like ceramic, and Damon 3 MX in 2005, in 2009 Damon Q, and Damon Clear in 2009, Damon Clear in 2014, and Damon Q2 in 2017. And finally, Dr. Damon tried to redesign the bracket, redesign the shape of the bracket and the torque to reach in Damon Ultima 2021. Because this is very nice system. I have to change the way I thought with this new approach of Damon system. So 5 stages of change: denial stage, observation stage, trial stage, acceptance stage, and embrace stage. So what is the meaning of these stages? Denial stage, when I have a new system, I see that why I choose this system. Is this system give us better treatment? I can obtain better results from conventional system. So I why use this system. So this is the denial stage. دائما لما اكو سيستم جديد أنا أشوف ليش دا أستخدم السيستم الجديد، خصوصا إنه البيشنت ما يدفع، خصوصا إنه غالي هو إلي والبيشنت ما يدفع، وأنا دا أقدر أحصل الريزلت، أقدر أحصل تورك. إذا مالي التورك أقدر أقلل شوية من يعني من اللايجيشن مالتي. فلهذا إنه هذا السيستم شنو حيوفر لي، شنو الجديد اللي حيوفر لي إياه، فدائما إحنا نكون في حالة إنكار. The other stage is observation stage. I heard that my colleague used this system with better results than conventional system, so I will try to use this system. So trial stage, observation and trial. After I try this new system, I obtain better results and reduce the treatment time, reduce the chairside time. All this give me a better treatment, better result, better patient cooperation. So this acceptance and embrace the stage. I can use it in every case. So this is the stage of the treatment. The fifth stages of the change. So we must come out from our comfort zone. Comfort is our biggest trap, and coming out from the comfort zone is our biggest challenge. So try to come out from the comfort zone. Try to use a new system, a new treatment challenge, especially in borderline cases. So in the borderline cases is very beautiful. The system is very beautiful. In the teenager, also we can obtain more development, more arch development without overload of the muscle, without the resistance from the muscle. So we can obtain a better cooperation of patient. Also reduce chairside time. So all this benefit to us and to our patient. Thank you for your listening. I will talk about the Damon Ultima System in the third part. Thank you.